Hi, I'm Dr. Kat Bogovic, Beverly Hills plastic surgeon, and today I'm going to discuss how a facelift is done. Now, there are a whole bunch of different variations, and every plastic surgeon has their own particular technique, but there's a few basic principles that everyone follows. The first one is the incision. Now I'm going to have you turn your head. So the incision starts at the root of the ear, and basically the incision itself is well hidden in the natural creases of the face. And for a woman, we generally tend to hide it behind this little tragus. For a man, sometimes if he already has deep wrinkles, we'll use that pre-existing wrinkle. The incision curves along the bottom of the ear, around the back in the natural crease of the ear, and then depending on the person's anatomy and their hairline, this is either extended backward or extended along the hairline. Sometimes this incision is also extended into the hairline, or it oftentimes can hug the hairline itself. After the incision is made, the skin is elevated off the entire cheek and usually off the entire neck. This exposes the deeper structure, which is called the smaz. And what the smaz is sort of a thick tissue with a little bit of fat. The smaz itself is usually then tightened, or some of it is excised and then pulled. And the direction of the pull is generally upward over the cheek and backwards behind the ear. And this allows for the structures of the face that have descended over gravity and time to be elevated back into a more youthful position. After the smaz is either tightened, which is called plicated, or excised and lifted, sometimes the face is augmented with fat grafting. So we'll take liposuction fat from another part of the body and put it in the cheeks or any other areas that have been hollowed out. Once the underlying structures of the face have been put in the correct position, the skin is then gently draped back over those deeper structures, taking care to smooth out any wrinkles there may be in the face, jowls, or neck. The extra skin is excised, and then the incision is carefully closed. Sometimes people leave drains in, or sometimes they use a glue to allow the skin to heal and sit down well without fear of there being any collection of fluid underneath the flap. Overall, this is a very commonly performed procedure, and most patients are extremely happy for having their face be restored to a more youthful appearance. Thank you for watching Mahalo.com's plastic surgery series. For more information, please feel free to visit my website at makeyouperfect.com or click on these links.